in Central Florida. So we did 24 stores across 3 counties in Hernando, Citrus, and Marion. And they do 100 to 125 shots a day for senior citizens. I went this weekend. We had all the Publix hierarchy down there. We were going to different stores. Everyone was really happy. It was a really professionally run operation. And so they said they can do more. And so for this week, as we got more shipment in, we said we've got to do more for Publix so that they can get it into our communities. So we announced on Tuesday we're going to the Panhandle counties with that. And then this morning I said we're doing St. John's, Flagler, Volusia over on the East Coast, and then here Collier in Southwest Florida. And what they're going to be able to do in Collier is 16 different Publix pharmacies are going to be starting right now. You can sign up on their website, Publix.com/COVID vaccine. You can make an appointment for the 65 and up. You come in here, they have everything set up. You sign in, you go, you sign the form, they do the shot, you wait for 15 minutes, and you're out the door. They space it out, reservation only, so that people aren't crowded in, and they get through a lot of people. So if you look at 16 stores in Collier, that's a minimum of 1,600 people a day that Publix will do. Probably more, because they're probably going to do more than 100 at each store, probably 125. So we think this is a good way to get this into communities for seniors. Not every place has as many hospitals doing this as others. We have some counties where, like a Miami-Dade, they got a lot of big systems that are churning out a lot. Others, it may not be as robust. So we believe that this can make a difference. So now, with today's signups and then the shots starting tomorrow at the new locations that we're doing, we'll have 105 public pharmacies offering vaccines throughout 12 counties in the state of Florida. So that's going to be a really, really big deal. You figure 105 locations, at least 100 shots a day at each one, probably more like 125. That's going to really, really be good. So everyone knows, it is by appointment only. If you just show up, they will give you information on how to reserve a reservation, but it's not something that people should be camping out for. Do the reservation ahead of time and then come in and do it. And obviously we're really focusing on our 65 and up population. When we did the initial shipments, remember, we were doing nursing homes, and that mission's still ongoing. Doing the healthcare workers, frontline workers, a lot of the hospitals have finished that. But then the question was, what do you do next? And the CDC was recommending focusing on a lot of workforce, younger workers. I rejected that because I thought we had to focus on elderly. And so we said we're doing 65 plus. We were the first state in the country to do that. A couple other states did follow suit. And then now, lo and behold, what's happened with CDC? They're saying you should do 65 plus. So Florida led on this. We put seniors first. And I think folks are seeing that that's the right policy. The results speak for themselves. We have more seniors that have been given shots by far than any other state. As of today, this morning's report, 60% of all shots in the state have gone to elderly. Most other states, it's under 25% have gone to elderly. We're close to reporting this morning almost 400,000 seniors have gotten shots. And just understand, what's reported in the morning is not up to date, because it takes sometimes 72 hours for these shots to get into the system. So we assuredly have done way more than 400,000, and that'll be made apparent over the next many days. If you go back the first week of January, we had 3 days in that first week where we did over 60,000 shots statewide. We were looking at it thinking if we could do 50,000 a day, that'd be a good pace. So we were already exceeding the pace in the first week, and I think as these numbers populate this week, you'll see that that the momentum is very strong. This is great for Southwest Florida. If you're in Lee or any of these other counties, we want to work with Publix to get it there too. I mean, I know there's a little bit bigger hospital system in Lee. We're going to work to do that. As we get more doses with the federal government, we're going to be able to hopefully have that luxury of doing it. So far, though, obviously the Publix partnership is great. And our philosophy is, look, if something works, let's double down on it. There's some other things that have worked okay, but when you see something working well, you want to continue it. But we have over 70 community vaccination sites across Florida in conjunction with county health departments. We have some major drive-through sites like Hard Rock Stadium in Miami-Dade, where they just had the national championship game. The Villages, we set up a drive-through site. It was supposed to be for their golf carts, but you know, it's a little colder in the Villages than it is in Southwest Florida, so they weren't ready for golf carts yet, but they will as it gets warmer. We've also partnered with houses of worship to be able to do this. So I think it's been something that we're looking at all kind of avenues to do it. When something's successful, we want to continue to do it. So that's what we're doing with Publix. So the question is going to be, I think, with the new guidance, and I don't know that we've gotten firm guidance about, are they going to continue to hold back doses or not? So far what they've done, if we got 100,000 Pfizer, that means they're holding 100,000 Pfizer for the booster shot. Some people are saying just get it because we're going to continue to get more production. So a couple things on that. One is we are subscribing to the booster shot. It's a 2-dose regimen. We're not going to not do the booster shot. So that's not even in consideration. The 95% effectiveness is the 2 shots for both Pfizer and Moderna. Yeah, 1 shot does give you some protection, but you're not getting 95. So we're going to do 2 shots. The question is, if they give us freedom to be able to get more people their first dose, knowing we're going to get more, how do we do that? So we're going to work through that and figure out what makes the most sense. But my sense is that because we're going to continue to get more, you can always decide later on to dial back in certain areas if you need more booster shots. Right now, we got intense demand for this, and we want to be able to get it for senior citizens. And I think it's going to make a really, really big difference. So we're happy with the partnership with Publix. We're happy to be in Collier County with this. I think the seniors in Collier County will appreciate having a convenient way to get this. And we're going to continue to do more. I mean, you know, we said we reported almost 400,000 so far seniors, but we've got over 4 million that we got to get through. Now, not all of them are going to want it, but most of them are going to want it. So we're not going to rest until, you know, every senior that wants a shot is able to get a shot. And every day we're able to do more and more. And as we get even more freedom with the supply, we're going to be able to do more and more. So thank you to Publix, and thanks for stepping up here in Southwest Florida. I'll take a couple questions. Yes. Yeah. Well, I'll do a couple reporter. Yes, ma'am. Oh, yes, ma'am. So it's not instead of. What we tried to look at kind of some. What we looked at some of the gaps is we have some medium-sized counties with heavy senior populations where the shots weren't where we would want them. So places like Hernando and Citrus and Marion that we did, the Panhandle, St. John's and Flagler and Volusia, and then now this. So it was more just we want to be able to get the numbers up for seniors, and the demographics were good, and the Publix footprint was really good. We do want to do Lee as well, and so again, as we get the doses, if that can work, we will absolutely expand it into Lee. I'm not sure about that, but I do know in the new, if you go to the Warp Speed press conference yesterday, they are going to start waiting for people 65 and up. And so, yes, we have a certain number of population, but we also have a much higher percentage at 65 and up. Up to this point, they didn't make any accommodation for that. Now they're going to start to do it. So we should get plussed up just on that, as well as some of the increasing production that's coming. I mean, you know, you look, like we have a higher percentage of elderly than almost any other state, but any big state we're way ahead of. Texas, California, Florida, or New York, not even close. And so that should account for this, because the more we can get out for elderly, that's when you're going to really start to see the big difference on this. And we're putting seniors first. They've recognized that's the right thing to do, and they're changing their calculations accordingly. So they've done a lot, and I think John can, but so they've gotten a lot signed up. There's still spots, but what Publix does is very smart, because this thing is like the new iPhone times 10 in demand. So like the servers melt when we do phones, the phone lines melt. So they make sure their website is staying up. They throttle it. So sometimes people have to wait a little bit, but that's all so that we're able to keep the appointments going. So they're going to be gone by the end of today. I'm positive of that. And that's pretty much how it's been. But what I would tell folks who weren't able to get an appointment today, they're going to keep, as new vaccine, as they get the next shipment scheduled, they're going to schedule you for that. And if you didn't get it this week, you're going to have a chance next week. It's going to happen. We have way more demand than we have supply, but this is going to happen. And so just hang in there, and as many ways we can do to make it happen, we're going to work to do it. So, but yeah, I mean, it's a very sought after appointment. And what's going to happen is, as if we continue to do the level we're doing, the demand is going to soften a little bit, just because a lot of people have gotten shots, and so then you may have an easier time getting through. And then next week may look a lot different than this week, because we're getting all this stuff done. So just hang in there. But yes, it's a very prized commodity right now. So
what's the number that you call?
it's a website. So it's Publix.com/COVID vaccine. What's that? Is it already full right now?
We're throttling. We're still throttling.
Okay, no. So they're throttling. It's not full yet, but they're throttling. There's a lot of demand, and so they're trying to get it so that we have a little bit of a bottleneck, so that the whole thing doesn't. When some of these things first get announced, I was talking to some IT guys. The pressure that comes on these sites is like a Russia-Chinese cyber attack combined, because it's just all at once, and they just really hit it. And so you got to throttle. So what they're doing is absolutely the right thing. So. Did it work very well? Okay. So we got a great.
I have to agree with him, Governor. And thank you. You're doing a fantastic job.
Thank you. Thank you. Thank you. Well, good. Well, we're going to be back. We're going to be back to Southwest Florida. This is obviously very important for seniors down here. And so I look to be able to hopefully do an announcement on the other Southwest Florida counties with Publix or other ways that we're doing it very, very soon. So for those of you who have gotten on the website, said that it was good, Publix appreciates that. We appreciate that. And we will see you all very, very soon. So thank you. Thanks. How you guys doing?
Well, I mean, he didn't really answer my question, but the thing is, I wanted to know is, do you have a sense that now that other states are going to do 65 and older, that Florida's going to have a tough time getting? Are you able to find out how many doses we're going to need?